I consider myself extremely lucky as a man to be able to have celebrated my 67th birthday back in September this year. The reason for that is that 2018-19 was a very difficult year for me and my wife. In September 2018, I was diagnosed as having an autoimmune disease incorrectly and was treated aggressively with steroids and immunosuppressant drugs for 6 months. Of apparently no real improvement. I was finally correctly diagnosed by Dr. Olivier Catin from Simitivay Hospital, and he suggested that I should be tested for sepsis, which used to be called septicemia. And sepsis is a potentially life-threatening condition that is caused by the body's response to an infection, which can lead potentially to septic shock and multiple organ damage, and then ultimately organ failure and death. Just as an interesting statistic, in the United States, approximately 1 in 4 people die from sepsis. The reason for this is usually due to the lack of diagnosis at an early enough stage. In some cases, people can go from an initial infection to death within a matter of a few days. So it can be very, very serious. Sepsis is actually a bacterial infection of the blood, but can also be caused by a fungal, parasitic, or a viral infection. The key thing is the early detection of sepsis, and some of the symptoms, there are several, but if you start to display maybe say 3 of them, you need to get to a doctor to check and ask if it could be sepsis. Some of these symptoms are as follows: fever, not always, but usually fever or chills, and feeling very cold, which can lead to extreme trembling or shivering when breathing is very difficult. Also, your body temperature can go down, and also in some cases people urinate less than once a day. Nausea and vomiting obviously is a symptom, as is diarrhea, but also fatigue and weakness, which is something that I suffered from. I also had blotching and discolored skin and slurred speech from time to time. Low blood pressure and syncope, where you pass out until enough blood gets to your head, is also another symptom, as is having a low white blood count. And that can only be really checked with a blood test, but if the number of white blood cells is below a number of 4 or above 12, that's a sure sign that you might well have sepsis. I was eventually diagnosed correctly in late May 2019, and I was admitted into Simitivay Hospital for 4 weeks of antibiotic intravenous treatment to try and kill off the bacteria that had correctly been identified. I was lucky in that the bacteria I had was responsive to lots of different antibiotics. The risk is, of course, you can have a bacterial infection that is antibiotic resistant. The problem I had was that the bacteria was hiding somewhere in my body, so that the antibiotics could not reach it to kill all the infection. So they had to identify where it was hiding. I had several checks, including checking my teeth, my heart, but eventually I had a PTE scan, which is called a positron emission tomography scan, using radioactive tracers at Bangkok Hospital. They were very good, and it identified that I had the bacteria hiding in a heart pacemaker that I had implanted in my chest in a different country some 12 years previously. The virus was hiding on the metal of the implant, as well as the wires that led to my heart and the 2 locations where it was screwed into the walls of my heart. The solution was quite simple. It had to be removed. The problem was that when I had it implanted in the first place, I was told that the implant could not be removed because of the screws in the heart. So I had to undergo another highly risky operation to remove the screws. Because the pacemaker had been implanted 12 years previously, a large amount of scar tissue had built up around the screws that were located in the walls of my heart. The operation had to be carried out at Ramatipidi Hospital in Bangkok, mainly because that is where the key laser equipment is located. I have to say at this stage that I want to thank incredibly the brilliant surgeon who managed to remove the pacemaker and her team, as well as all the staff at Samitiwe Hospital who cared for me before and after I returned there for convalescence and further treatment. The operation to remove the pacemaker took 9.5 hours. Well, that was how long I was in the operating theatre, but it was all very successful. After 4 weeks of continued antibiotic treatment, I was officially cured, although I did have tablet form antibiotics for a slightly longer period after I was discharged from hospital. It was on the 28th of June 2019. I then entered what has only recently been discovered by some doctors as what is called the post-sepsis syndrome period, which is a period of time which can last up to 18 months after you've had sepsis. And the symptoms are, there are three main symptoms. One is arthritis, pain in the joints. The second one is muscle weakness, considerable muscle weakness. And the third one was mental impairment. I suffered from considerable muscle weakening. I could not stand up from a sitting position, for example. I also suffered from mental impairment when it came to typing or using a word processor. I couldn't correctly identify the keys. The latter one, the mental impairment, has returned to normal. And after I got over a period of anemia, I was able to exercise once again, as you can now see from the video. My muscle strength has gradually returned to normal. It has taken a long time. More recently, I've started a routine of doing speed cycling on a machine that I bought locally, whereby I do a 40-minute, quite intensive and hard session. And I need a little bit of encouragement musically, as I used to have in the music studios in gyms when I've done speed cycling. And so I listened to Jeff Beck's album Guitar Workshop. It's a great album because he's a great guitarist and he has tremendous musicians, particularly Terry Bozzio on drums, who helps me keep up a good rhythm. The album I use is Guitar Workshop, which lasts for 40 minutes. And there are a variety of different tracks which help me do speed and strength training accordingly. I encourage you all to take up cycling if you don't already do so. It's a great form of transport, very economical, environmentally friendly, and does you a great deal of good. I used to do a lot of endurance training, including marathon running many years ago when I was a lot lighter, but now I'm too heavy, and so cycling is a great alternative form of exercise for me. I love spending the time on the speed cycle, even though it's hard work, but afterwards it's incredibly rewarding. I'm now well on the road to recovery and feeling 100%, and I am very, very grateful to, as I've already said, doctors and nurses and care staff at the hospitals that I've been in, but also to my wife, who, along with the nurses at Samitiwe, looked after me for the whole time that I was admitted in hospital, and before and after. So thank you to them all. And I hope that if any of you display any of the symptoms of sepsis, that you check it out. I urge you very strongly to go on the internet and research a little more about sepsis. Too many people die from it, again, because it's not diagnosed sufficiently early. So early diagnosis is absolutely vital. I think it's important for me to make clear that since I have recovered from sepsis and the infection was completely removed from my body, the doctors and cardiologists have shown quite categorically that I do not need to have a replacement of the pacemaker implant. In other words, I never really needed the implant in the first place, the pacemaker. I always thought that was the case because when I used to have it checked every 6 months, they used to always tell me that it only operated for about 5 or 6% of the time, if that. And that was when my pulse dropped below 60 beats per minute, which was probably when I was asleep anyway. And so therefore, the issue with the pacemaker had always been one for me, but I had to trust the doctors who tell you that you need one. This is perhaps one of the disadvantages of private health insurance, where profit motive means that doctors have a greater incentive to carry out a larger number of tests than is really required and carry out procedures that are not really necessary. I feel very lucky that I am now able to live a normal life without having to have a pacemaker re-implanted. I don't need one. And more importantly, I never did. So finally, all I really want to say is I want to wish you all great health, a long life, and above all else, happy cycling.